The government knew last summer, and for years before this, that we needed doctors to staff our ER. So my question to you, Mr. Curry, is this: how can we attract doctors without our own local recruitment officer?
Certainly, recruitment to rural communities in this province is no different than it is in any other province in the country. And certainly as a minister, I recognize that there's a high level of frustration. We're certainly continue to look, and I don't have all the data and the evidence to look at the number of site visits. It's been a challenge to retain and stabilize rural physicians since 2002 and even earlier. But the challenge is that we put incentives on the table. We have rural recruitment initiatives. We recently rolled out before Christmas. We offered family residency students a check basically for $110,000 for a 5-year commitment to rural communities in Prince Island. I think there's a lot of upsides in our community hospitals. There's a lot of opportunities, but you know and we continue to find creative ways to try to attract them to rural Prince Island.
What is the sense of taking 5 acute care beds out of Surrey, or so many acute care beds out of Alberton or Leary, putting them into Charlottetown, and then what are you going to do for the people who need acute care beds in Leary and Surrey? Send them to Charlottetown. And instead of getting into that hospital in 1 hour, they're going to wait 6 or 8 hours in ER, and then maybe on a stretcher and waiting for something in Charlottetown or Prince County. Here is a suggestion if you need more beds. All those hospital beds, like in Surrey, went down from 22 to 17 active beds, and then were filled with office workers, desk pilots I call them. Why not reactivate those beds? And I'm sure there's more at Prince County and the hospitals up west. Just get rid of those pencil pushers and people who can't leave their desk without a piece of paper to make themselves look important, like they're doing something, and reactivate those beds. Why can't you do that?
The total number of beds in the province is actually not, there's not an increase in beds needed. We need to use the beds more appropriately. We need to admit people to the hospital more appropriately, and we need to get them out of the hospital in a timely manner so they can return home. That is the ultimate goal. It's not the number of beds. So adding more beds, you're right, we'll put more people in beds, but that's not getting to the point of making sure that they're in the hospital appropriately and they go home at the appropriate time.
The other thing that concerns me is the addiction issue on the island, in West Prince, and all that that affects. Do we really know how serious that is of an issue? Kids in junior high, it's not alcohol, it's drugs, mixing, and it's getting worse. And our young people have to go west. As a friend of mine in the program of AA said, the good ones go and make the money, and those who can't pass the drug test are home, and we have to look after them. They're diseases. They're not bad people. An addiction is an addiction. It's a disease. But I'm really concerned for my stepchildren, young girls. What are they going to have? I've been well served at this hospital, O'Leary Hospital, and at every hospital in this island. But, as the minister has said, we are in very serious trouble. This is not to be a political issue. This is to be human rights. Dignity for every person, child, adult, family people. Serious. I wish you well. You got your hands tied. First place, clean up the Shaw building.
Mental health and addictions here in the province, the acute system tends to get all the focus and attention because it's where we spend. But he also acknowledge the oncology unit at the Cancer Treatment Center. We have Islanders every day coming in there. That one keeps me up at night to try to recruit 2 oncologists here in the province. Prince Ryan's a very specialized area, but we're continuing to move towards that. And I really appreciate Leo's comments. This discussion, healthcare, the politicians need to be completely out of this discussion altogether. And this can't be a political issue because healthcare must transcend politics. There's too much at stake. So I'm trying to look at healthcare from an equity perspective. There's a volume of money we have. We increased physician salaries in this province from 07 from $62 million to $105 million. These are just realities, and we talk about recruitment and trying to retain physicians. Well, we got to pay our physicians. So that's just a snapshot from $62 million to $105 million for 225 physicians. That's the salaries that we pay here in the province. And this is a very serious discussion about the future of this province and the sustainability and viability of communities. And as I said, this is about driving people out to communities, not only driving people into Charlottetown. So I wanted to clarify that. Thank you.